I'm Suzannah Tedesco, the paramedical esthetician at the Center for Facial Cosmetic Surgery in Livonia. And this month we decided to do a special on laser hair removal for the underarm area. The reason I chose this for the month of July is because a lot of our treatments here can't be done on tan skin, and I know it's a little tricky to stay out of the sun in these nice, warm, sunny months. So I thought that the underarm special would be great because it won't interfere with your summer activities. So if you're curious if laser hair removal is right for you and wondering if you would be a good candidate, you would be a good candidate if you have dark hair. The hair color is much more important than the color of your skin because the laser is attracted to the pigment, which is the color of the hair, and if the hair is too light, then the laser will not recognize your hair color and it won't target the follicle to destroy the hair follicle growth. The laser that we use here is an ND YAG laser, and that's by a company called Cyton. This laser actually has the capability to work on the lightest skin up to the darkest skin. So I like to stress that because there are some myths when you are doing research about laser hair removal, and I commonly get asked the question about skin color, and this laser absolutely has the ability to work on the darkest as well as the lightest skin colors. Once the treatments are complete, you really should have permanent reduction in that area, and you shouldn't see hair coming back in the way that it was present when you started the treatments. If you decide to come in for a consultation for your underarm treatment and you'd like to have treatment the same day, we can certainly treat you the same day. We just need to make sure that you've shaved about 3 days prior to the treatment. That way the hair is the appropriate length, which is basically stubble. We don't want the hair too short and we don't want it too long. So about 3 days is great. And if you do that, we can go ahead and treat the day that you come in for your consultation. So this is our lovely patient Lorena, and she's here today to get her underarms treated with our laser hair removal treatment. As you can see, the underarm area is perfectly trimmed so that she just has a little bit of stubble, and that's really what we're aiming for, is just a little bit of stubble so that the hair is not too long for the treatment. Let me know if this is okay for you, yes, comfort-wise, Lorena. Does that feel okay?
Yes, I barely feel it.
How's that one? Still comfortable?
Yeah, yes. Okay. Just gonna go ahead and go to sleep.
Does it have a little more of a sting to it?
No.
So this is pretty much what you can expect from the treatment. Now everybody's tolerance is a little bit different, and I think that Lorena really has a good high pain tolerance. The sensation she's feeling is, what would you describe it as, Lorena?
If you're getting your eyebrows waxed a little bit or plucked, it's kind of like a plucking feeling, but it's not like where it's completely uncomfortable.
Okay. So that's basically the treatment, and I would normally go over any given area anywhere from 2 to 3 times, so that would have been considered one pass. As you can see, the skin color is the same as prior to treatment. There's just a little bit of pink color around the area that I treated, and that pinkness will go away probably within the next couple hours. It's very short-lived. So now I will be demonstrating the laser hair removal process on a lighter skin type, and I'll be using the same machine, but the handpiece is a little bit different than the handpiece I used on Lorena previously. Okay, you ready? Here we go. 3, 2, 1. Is that tolerable for you?
Yes.
Okay. With this treatment, I would always also pass over the area anywhere from 2 to 3 times, depending on if it's tolerable to my patient to continue. At the very least, I like to do 2 passes. So, how did that feel as we were treating? Was it very uncomfortable for you?
It was hot.
Hot? And how is it feeling right now after we finish that pass?
It just feels warm.
Warm? Okay. Not hot or burning? Okay. So we would go through and do another pass, and the skin is changing a little bit. It's slightly pink, but you know, not very much so. The hair is starting to singe, and that's pretty visible right now, which is a good sign. Just means that she's responding well to the treatment. And how would you rate the heat now, Sarah? Is it getting hotter, or is it still just a little bit warm like before?
No, it's hotter and more uncomfortable.
Okay. So I would probably stop with this pass. Basically, after the treatment, she can go back to any normal activities. There's really no restrictions. She can shave as soon as she wants to after the treatment. And about 2 weeks after today, all of the hair will shed out of the area, and it will remain gone for a few weeks prior to her next treatment. So hopefully that was very informative, and if you have any questions about the laser hair removal process and would like to come in to take advantage of our special in July, please feel free to give us a call. You can make a consultation, or I can talk to you over the phone if you have questions before you can make it into our office.